It's a pleasure to be here talking about this today because today is actually International Whole Grains Day. So this topic is very fitting. This webinar is sponsored by the General Mills Bell Institute of Health and Nutrition. If you're not familiar with the Bell Institute of Health and Nutrition, they're a dedicated group within General Mills whose mission is to be the source of scientific health and nutrition expertise for the company. They believe food should make us better, so they work hard to make food the world loves. And with that, I will introduce our first speaker. Kevin Miller is a principal scientist in the General Mills Bell Institute of Health and Nutrition. In his role, Kevin is responsible for ensuring that General Mills products comply with external and internal nutrition regulations and guidelines. Kevin also provides input to key company stakeholders on multiple nutrition topics, including whole grain, carbohydrates, fiber, protein, and fortification. Previously, Kevin worked as a scientist in healthcare nutrition, studying nutrition interventions for improved patient health outcomes. In both current and former roles, Kevin has maintained his passion for building healthy dietary lifestyles that improve overall public health. I'd also like to introduce our next speaker. Allison Yoder is the Nutrition in Food Retail Program Development Fellow through the Academy of Nutrition and Dietetics Foundation, leading the Leveraging Dietitians in the Food Retail Environment to Improve Public Health project. Allison is a registered dietitian nutritionist and leader in the retail health and wellness industry with over 16 years specializing in business development and health and well-being strategy. She is certified in adult weight management and a trained lifestyle coach through the National Diabetes Prevention and Recognition Program. It's a pleasure to have you both speaking here today. And with that, I'll hand it over to our first speaker, Kevin.
Hi, thank you, Kelly. I just want to thank everyone for the opportunity to be able to present some of the data that I've been involved with regarding health economics and whole grains. So I'd be remiss if I didn't acknowledge several of my colleagues, contributors from the Whole Grain Initiative. And if you haven't heard of the Whole Grain Initiative before, it is a global consortium that's comprised of both academic and industry scientists. And we have a working group that's specific to the health economics of whole grain. Most recently, we published a paper in Finland, but we're going to spend most of the time focused on the US data that evaluated the impact of whole grains on both cardiovascular and coronary heart disease. So the reason that we need a lot of this is, unfortunately, there's a lot of information, and I actually would probably phrase that as misinformation regarding the role of grain in the diet. So for example, we see books like Grain Brain and Wheat Belly published by medical doctors that are indicating that wheat and other forms of grains may actually be unhealthy. However, consumers are faced with this choice between choosing between refined grain and whole grain, or even no grain in their diets. But we want to make sure that we are providing an evidence-based approach to this. And therefore, it's important that we look at whole grains and how they're consistently associated with very important health outcomes. So the correlation between higher whole grain and reduced risk of both cardiovascular and coronary heart disease, type 2 diabetes, other impacts such as constipation, perhaps even data on colorectal cancer are pretty much undeniable at this point. And I think this is best exemplified when we look at the global burden of disease study. So this is data that was collected back in 2017 and then published in The Lancet in 2019. And I like to share this because it shows that of all of the different dietary factors impacting death on a global scale, diets high in sodium were number one. However, what's probably not recognized by many is that diets low in whole grains are number two. So diets low in whole grains actually outranked diets that were low in fruits, diets that were low in vegetables, or diets that were low in nuts or seeds, or even the omega-3 fatty acids. And looking at this graph, we can see that the majority of both diets high in sodium and diets low in whole grains are predominantly associated with cardiovascular disease, but also type 2 diabetes as well. So what do we need to do with this data? Well, what we need to see to be able to promote whole grain consumption to take advantage of the health benefits is more clear and consistent dietary guidance. And some may argue that, but dietary guidance around the world recognizes whole grain, and that's true, it's undeniable. So let's take, for example, in the United Kingdom, dietary guidance says to choose whole grains where possible. And I think it's really difficult for consumers to interpret what exactly they're going to do with that when they go to the store. How much should they be eating? Where do they find these foods? Sweden does a little bit better job with their dietary guidance by the recommendation that women should be consuming 70 grams of whole grain and men should be consuming 90 grams. But that still leaves some vague nature as to, what are the sources? How should they be getting this? Other countries, including the Chinese dietary guidance. Now there they say to consume at least 50 grams of coarse grains. But the complication of the 50 grams of coarse grains is that in China, coarse grains are referring not only to the cereal grains, where the research has demonstrated the benefit, but coarse grains is also referring to the pulse and legumes. So lentils and chickpeas, soybean, all of these things are being included in that as well. So it's difficult for consumers to, again, understand what food should they be consuming. Now, many of you are obviously familiar with dietary guidelines for Americans, in that consuming at least half of your total grains as whole grain. And there's actually a quantitative recommendation of getting 3-ounce equivalents. And that's based on the average of people consuming approximately 6-ounce equivalents of total grains. And if you work that out based on a slice of whole grain bread, you get about a 48 grams of whole grain in the diet. So that's been roughly translated as a recommendation. But what we need to see, based on what you've observed here, is more global consistency that can help consumers identify how much they should be consuming and what they should be consuming as well. So one of the ways that we can actually influence governments to take on this task of creating clear and consistent guidance is using things like health economics. So if you're unfamiliar with it, health economics are a tool that policymakers will typically use to evaluate different interventions or programs, and they'll evaluate that investment, whether that be advertising, campaigns for public education, against the return on their investment. And the return could either be monetary or it could just be public health. On the left side, I've always been kind of entertained by this question that was asked of students of what is health economics? And they reported back that it's going to be policy, it's going to be effectiveness, it's going to be patient care decisions, and all of these things are correct. So when we look at a couple of examples for the private sector, hospitals, now they may be evaluating different standards of care, and that standard of care could be different medication, different nutritional interventions, different equipment, different practices. And so, for example, they may look at readmission costs for those patients or improved health outcomes. And as a result, they can help to determine where should they be spending their limited resources. In the public sector, there's an example I found that I appreciated, and that was housing the homeless. So they determined that if they did nothing, that 100 people who remained homeless would cost the public service system $7 million. And then in contrast, they looked at if they were to invest $2.7 million for those 100 people and change their lives with affordable housing, that therefore they could save the difference between those two of being about $7 million. But the reason these decisions can be complicated, even when we look at nutrition, is that that investment of $2.7 million is difficult when you're writing out a check, especially when the savings of $7 million may be across multiple different programs and different agencies. And that's what health economics does. It brings together all of the relevant information to facilitate the right decision-making process. And we know economics can be a huge incentive for governments to take action. So, for example, in 2017, the American healthcare spend was a staggering $3.5 trillion. And that works out to be a little under $11,000 per person. Likewise, in Canada in 2018, we saw that healthcare expenditure was around $253 billion, which equates to around $7,000 per person. Now, you're already seeing that there's a discrepancy there between how much it costs per person. And a lot of that is attributed to the fact that they're using a socialized healthcare system. Likewise, in The UK, we see that government and non-government spending on healthcare was around 200 billion pounds, and that works out to be about $4,000, maybe $5,000. And therefore, the point is not to show out the inconsistencies with our healthcare systems and what it costs per person, but just to show that the scale of how much money is spent, especially in the United States, and the opportunity for us to utilize simple dietary lifestyle interventions that can help to defray some of these costs. So let's look at the design of a health economic study. So in our case, what we need to do is understand where we currently are, and then the goal of where we're trying to go. So we're going to assess the current whole grain consumption. Secondly, we need to establish a dose response. So how much intake does it require in order to receive a specific benefit? And then next, we're going to calculate the disease risk reduction against the ideal scenario. So in this case, the ideal scenario is going to be achieving the Dietary Guidelines for Americans recommendation of making half of your grain whole. Then we're going to look at the actual direct healthcare costs. So when I say direct healthcare costs, that's referring to the cost of hospitalization, the cost of the medical treatments and medications to the patient. That's not looking at the cost of lost wages, the cost of a spouse or a child taking care of you, the cost of family members staying in hotels or anything else. It's just the actual healthcare costs. And then with that, we're able to estimate the cost savings of whatever dietary intervention, in this case, increasing whole grains, to alleviate that burden of the disease. So health economics will take that. Then we can subtract the cost of estimated programs. That could be television advertising, it could be educational campaigns, infomercials that come out to determine the true value of a program. So in our case, let's specifically now look at whole grain consumption. Utilizing data from the 2015-2016 data set, total whole grain consumption by US adults, and that's people over 20 years, was determined to be 6.34 ounce equivalents. So I'm just going to say now, ounce equivalents is really clunky for me to keep saying through this presentation. So we're just going to use the word servings, right or wrong. We'll just say servings going forward. So if the average total grain consumption is 3.64 servings in the US, and adults are getting a little bit less than one serving, 0.93 servings of whole grains per day, that means that we're getting about 5.4 servings per day as refined grain. But Dietary Guidelines for Americans is saying half the grain's whole. So our goal would be getting half of that 6.34 servings. That would be giving us, the 3.1. So therefore, when we look at the amount of whole grain we should be getting versus the amount of grain we're getting, we're able to identify that gap. And that's what we're going to use in our modeling scenario, is the 2.24 servings of whole grain as a gap. And that's our ideal objective. But we recognize that that is a tall order. We can't expect everyone, adults in the population, to be able to achieve more than 2 servings of whole grain per day, given that the current intake is only 1. So we're going to look at this incrementally. We're going to start with 0.25, so a quarter of a serving a day, then half a serving, 1 serving, 2 servings, all the way up to the ideal goal of 2.25 servings of whole grain per day. And if you may ask whether or not that really seems achievable, I really appreciate this graphic from the Whole Grains Council that puts this into context. So 1 cup of oatmeal is the equivalent of 2 servings of whole grain. Substituting 2 slices of refined grain bread in a sandwich for 2 servings of 100%, like for example in this picture, 100% whole wheat bread is going to be 2 servings. Half a cup of brown rice in your Chipotle burrito versus the polished rice would be 1 serving of whole grain, or a serving of 1 cup of whole grain ready-to-eat cereal, again, a serving of whole grain. So these things are very achievable, but it's still important to look at this incrementally. The next step that we have, as I mentioned before, is to estimate the dose response. What do we think the benefit is going to be based on the consumption, in this case of whole grain? So we looked at 3 different outcomes: cardiovascular disease incidence, coronary heart disease incidence, and stroke incidence. Now, unfortunately, the data were not statistically significant for stroke, so we're just going to eliminate that going forward and focus on cardiovascular and coronary heart disease. So I'll draw your attention to the right side column, because that's the easiest one to look at. On the published literature, the relative risk of 30 grams of whole grain is 96%. In other words, there's a 4% reduction in cardiovascular disease risk for every serving of whole grains, or 30-gram serving of whole grains. Where coronary heart disease, we saw that there was a 5% reduction in relative risk for every 30 grams. So that's the data that we're going to use modeling going forward to figure out the cost savings. So as I showed you before, there's the incremental approach that we have of this. So let's start at the very bottom. For every quarter serving that the US adult population would have of whole grains, we could expect to see on average a savings of $2.4 billion in the direct medical costs. And the numbers next to that in the parentheses, that represents a confidence interval. So just based on the statistics, as I mentioned before, that's the average, but we could see anywhere from as low as 600 million up to $4.1 billion in cardiovascular disease savings alone. When we look at the coronary heart disease, $1.5 billion with that confidence interval of 900 million up to 2.4. So now imagine that the population of adults in the US got to 1 serving per day. We could see a combined average savings of $15 billion on these 2 endpoints. Or if we actually did achieve Dietary Guidelines for Americans recommendation of 2.25 servings of whole grain per day, we could see as much as $35 billion in savings for these 2 endpoints. And that's looking at on the expected average. So it's important to note that's for 2 endpoints, cardiovascular disease, coronary heart disease. What about all of the other disease endpoints that are of interest? And that's the reason I believe it's very important for us to briefly now look at work that was recently published from the University of Eastern Finland. So our colleague, Dr. Jaana Martikainen, had looked at a slightly different approach. So one, I want to point out that he looked at type 2 diabetes versus cardiovascular disease. And he used 3 different scenarios, slightly different from ours. So the current situation in Finland is that 70% of the population is getting approximately 1 serving of whole grain per day. So in the first scenario, what if you could increase that from 70% to 80% of the population getting just that 1 serving? So only asking for a 10% shift, an increase in the population eating whole grains. Or in scenario 2, what about that 70% now getting 2 servings of whole grain per day? What could you save? Or the ideal would to see the combination of those 2, that would be shifting from 70 to 80%, and now they're also getting 2 servings per day. So we also have to look at the economics. So type 2 diabetes costs in Finland come out to be about $1 billion, 1 billion euros per year. And that's based on some 10-year and 20-year data that were pulled from the Finnish population. What's interesting is that he also analyzed the impact of whole grains on the quality of life and found that of those 3 scenarios, you could see a range from between 80,000 and 276,000 quality adjusted life years. And what that represents as people living without morbidity. So these are people who are ambulatory, they are contributing to work, they're not relying on loved ones to help care for them. So it's a very important endpoint that we can think of as that quality of life. Maybe happiness is a bit of a stretch, but still those people are productive citizens contributing towards their country. So within the population of Finland of only 5.52 million people, there would be an estimated savings of $300 million to $4.2 billion through those 3 scenarios that were shared. So it's a small population, but what now if we were to think of this study being extrapolated to the US population? As mentioned, the population of Finland is less than the population of Chicago, and they had an estimated savings between 300 million and 4.2 billion euros. Now, if we extrapolate that to the US, data from the American Diabetes Association indicated that direct medical costs associated with type 2 diabetes in the US alone is $237 billion. So modeling just 1 serving of whole grain suggests that on average, we could be looking at a savings of $64 billion in direct healthcare cost savings of type 2 diabetes alone, or to 2 servings getting $83 billion in that direct savings. So now we have to think of that as a tipping point. How much are we willing to invest in educational programs to incentivize consumers to eat more whole grains, to substitute that refined for whole grains, to be able to achieve savings such as 64 billion with type 2 diabetes alone? So as a conclusion slide here, how can we use these data? So to start with, in the private sector, Health insurance companies, retailers, food manufacturers can all play a role. For example, in health insurance companies, they can incentivize their members, their clients, perhaps through couponing systems to get them to eat more whole grains in their diet, or to at least somehow reward people with lower premiums, perhaps, to get more whole grains into their diet. Retailers could perhaps make whole grain products more conspicuous on end of shelves, or to have more promotions for those foods to draw consumers' attention to them. Food manufacturers may be more incentivized to include more whole grains into their formulas if the consumers are being drawn more to that. And then, of course, there's advocacy as well. We need to have data like these to provide that compelling rationale for why governments and other agencies would want to create more clear and consistent dietary guidance to incentivize those consumers. Physicians, dietitians, nutritionists could all work on prioritizing recommendations to their clients and patients as well, to get them to swap out refined for whole grain foods. And then, of course, the academics, which is honestly a lot of the target that I'm working on it with as well. The study from the US that I commissioned with a couple of colleagues from Exponent, that was done on, quite honestly, kind of the back of the napkin approach. There's much more sophisticated modeling approaches, such as microsimulations, as used by Dr. Martikainen in Finland, Markov studies, that could be very compelling for governments to look at. So what we're trying to do is spur the interest of the other academics to look at new data points. We share data with cardiovascular and coronary heart disease in the US, and also type 2 diabetes in Finland. But the Australians have actually done work on gastric cancer as well. So those are studies. But what about other things? For example, emerging evidence on dietary whole grain and cognitive function. So there's a great new area and wealth of information that we can take and start thinking of not just health economics, but also of nutrition economics. So thank you very much for your attention to this, and look forward to some questions. I will now turn the presentation over to my colleague Allison here.
Hi, everyone. I am so excited to follow Kevin's presentation and begin to talk about how we're going to use the data that Kevin presented today. And so just to give you a brief background on myself, I am a fellow through the Academy of Nutrition and Dietetics, and I've been spending the last couple years researching this concept of food as medicine, really looking at the connection between food and health and how we can begin to integrate opportunities for food as medicine within food retail settings. And so today we're going to be focusing on 3 sections within the presentation. We're going to build from just that great amount of information that Kevin presented and really discuss opportunities on communicating the health economics of whole grains through programs and initiatives, especially led by registered dietitians, but really programs that connect food with health. The amount of healthcare dollar savings by improving whole grain consumption that Kevin presented was just astronomical. So the key will be, how do we meet individuals where they're at and help them make those methodical steps towards increasing those whole grain consumptions within their lifestyle. We're then going to dive into the research that we've been doing through the Academy of Nutrition and Dietetics around that concept of food as medicine. And then we'll wrap it up with some practical applications for dietitians to implement whole grain initiatives using a food as medicine framework that we developed from key findings from our food as medicine research. So really, for a while now, we're seeing this shift in emerging consumer shopping habits. And as consumers continue to prioritize health and well-being, we are beginning to see different kinds of responses through food retailers, as well as food manufacturers, the food industry, and with this past year, even further heightening the awareness between food and health. And now is the time that we really start to develop those programs and initiatives around the connection between food and health. You know, the consumer definition of food value, this goes beyond taste. price, and convenience. It now includes health and well-being into that definition. Consumers and food retailers have been increasing their focus on health and well-being. And again, like we said, this is just a trend that has only accelerated during the COVID-19 pandemic. Health and well-being was already undergoing shifts leading up to the pandemic. So as consumers of all generations are starting to pay more attention to health strategies, and this could be from personalized nutrition, this could be from better for you type foods, even food as medicine initiatives. According to FMI's The Power of Health and Wellbeing report, during the pandemic, consumers have continued to focus on these areas, and they were reporting paying more attention overall to improved nutrition, healthcare, and self-care for themselves. You know, in fact, in FMI's Grocery Shopper Trends Tracker, this was done last August of this year, 35% of consumers say that they are eating healthier now than even before the pandemic. And consumers are leveraging food to promote health and well-being and help to manage their disease. Based on responses to a joint survey that we did through the Academy Foundation, we collaborated with FMI on this earlier this year. Consumers are reporting the inclusion of food groups from the Dietary Guidelines for Americans, and they're including these food groups to gain specific health benefits. So while this slide refers specifically to whole grains, we do have a food as medicine report out where we include the larger chart that shows the percentages for all food groups with connection to specific health benefits as it's described in the dietary guidelines. So as you see here on this slide, 73% include whole grains into their diet for heart health, diabetes management, or fiber benefits. So that we know, this shows 21% of consumers. There are this category of consumers that are aware of the connection between whole grains and health benefits, but they're choosing not to include them in their diet. And although we know consumers are making the connection between food and health, 3/4 of consumers that were surveyed are beginning to include whole grains into their diet. But as you can see on the chart here, majority of Americans are still not meeting the recommendations of making half of their total daily consumption of whole grains. So our job as healthcare practitioners is how can we help them make those steps towards increasing consumption? What are those specific baby steps that we can be making? So in a literature review of 48 studies, researchers looked at factors that are influencing whole grain consumption. They reviewed facilitators and barriers in both children and adults, and then they identified the reasons for success or failure of programs that have tried to impact whole grain consumption. So the graphic that you see on the slide, it's a bit of an eyesore, but I'm going to break it down, the main concepts on the next slide for you here. But you can start to take a look at what are some of those facilitators and barriers that are impacting consumption. The most cited barriers to whole grain consumption include a dislike for the taste or the texture of whole grains. In some areas, there's just simple poor availability of being able to access whole grains. And another major barrier that was identified was the difficult to identify what a whole grain is, as well as a lack of knowledge on how to prepare whole grains. So programs that demonstrated the most success with whole grain consumption, they focused on increasing the availability and the variety of food that's containing whole grains. These programs focused on improving the sensory appeal of whole grains, reducing the purchase cost of whole grains, but also improving the communication and the labeling to enhance a consumer's ability to identify products with whole grains. So keep these whole grain barriers and facilitators in the back of your mind. I'm going to change traction a little bit here and talk about the research that we're doing through the Academy of Nutrition and Dietetics Foundation. At the end of the presentation, I'm going to circle back in on those facilitators and barriers, and we're going to start to tie everything in together with the research outcomes that have come out of the things that we've been studying. So really, why are we focused on the concept of food as medicine within the Academy Foundation? Really, where we see registered dietitians are natural leaders of connecting food and health. Dietitians work as trusted allies with individuals in the promotion of food, nutrition education, and access through practical solutions that are grounded in science and credible research. In 2019, the Academy of Nutrition and Dietetics Foundation received a grant from Walmart for a new project. We titled it Leveraging Dietitians in Food Retail to Improve Public Health. As a result of this, the Nutrition and Food Retail Fellowship was created, and that's what I've been working on. I was brought in to lead this project. For the last 2 years, we've been conducting research and looking at opportunities to integrate food as medicine interventions with current and future food retail nutrition programs. So through our research, you can see some of the publications here on the slide. We've developed a conceptual definition for food as medicine. We've identified pathways to intersect the role of registered dietitians within food retail. And we've provided recommendations to integrate food as medicine programs within those current retail nutrition models. So the publication that you see here on the left is a scoping review that we did. And within the scoping review, we analyzed the landscape of food retail nutrition programs. And we also looked at food as medicine interventions in food retail settings. We wanted to see which types of programs were out there. But in addition to that, we really wanted to take a deeper dive to see which programs had improvement in health outcomes while also producing a positive return on investment. The retail nutrition programs and outcomes scoping review, if you want to take more details into it, it was published in the the Journal of the Academy of Nutrition and Dietetics last November. So the images that you see here on the screen are those 3 publications that we've developed. The middle resource, the Food as Medicine Retail Nutrition Landscape, this describes 3 outcomes that came out of the scoping review research. The food as medicine definition, 5 program models that I'll go into more detail about, as well as a retail nutrition framework that we developed. And then on the right is a publication that we launched last September. It was in collaboration with FMI, the Food Industry Association. But we looked at a 4-phase research study, which explored different perspectives of the concept of food as medicine. So we wanted to see what people thought about the concept through the lens of consumers, food retailers, and registered dietitians. And with this insight, then we were able to lay out opportunities for food retailers and the food industry to develop food as medicine initiatives using those 5 program models that we're going to talk about, and then pairing them with key target shoppers and focus areas that are outlined in the definition. So earlier this year, like we talked about, the Academy adopted a definition for food as medicine. And this was based on key findings that came out of the scoping review research. This conceptual definition is really grounded in science. Our ultimate goal was to connect food to health in responsible and practical ways. And we have 4 distinct focus areas highlighted here on the screen. Food as preventative medicine to encourage health and well-being. Food as medicine in disease management and treatment, food as medicine to improve nutrition security, and food as medicine to promote food safety. So really the concept of food as medicine is simply just a reaffirmation that food and nutrition play a role in sustaining health, preventing disease, and as a therapy for individuals who have conditions or who may be in situations that could be responsive to the diet. So our goal of the definition was not to replace medication with individuals, but rather to look at the role that food plays and its connection with health and well-being, disease management, nutrition security, and food safety. So here you see on the screen, we have 5 models that were identified from the scoping review that demonstrate food as medicine programs and how they can be applied in the food retail setting. So you see here a prescription program. This operates like a traditional prescription. It allows dietitians and other health professionals to prescribe subsidized food. And then with an incentive program, this can range from providing coupons and vouchers to discounted pricing on food categories, so such as fruits and vegetables, rebates in the form of cash incentives and discount coupons, and then even disincentives, so taxes on certain items would fall within that category. The middle category you see here is medically tailored nutrition. So this provides a more comprehensive therapy for patients who really could benefit from improved nutrition. So with this model, a registered dietitian or another healthcare provider writes a prescription for the patient to receive either tailored meals or boxes of food that align with the patient's health condition or diagnosis, such as diabetes. And then the last two program models we really found were very specific to the food retail setting. These are what we saw existing nutrition programs and initiatives focusing on. So with path to purchase marketing, this includes program models that are either designed to produce behavior change or environmental change, but these programs are focused right at the location where selection of food for purchase occurs. And then lastly, with personalized nutrition education, this includes individualized approaches to health and well-being. So this could either engage dietitians or nutrition resources directly with the consumer. And this interaction can occur both in person or virtually, but it's ultimately resulting in that positive behavior change. It's important to note here that really a big outcome that came out of the scoping review was this realization that utilizing a combination of program models. So this could be pairing a produce prescription program with an incentive, as well as medical nutrition therapy with a registered dietitian. But this combination of programs is what greatly increased a food retailer's success in producing both return on investment as well as positive health outcomes for participants. So taking everything that we learned from the scoping review, we developed a framework to assist food retailers in developing food as medicine programs. As you've probably seen, and as we definitely saw within our research, every retailer's health and well-being program was so incredibly diverse. So really we found that having this framework provided that solid foundation for retailers to begin to build their programs from. They can pair those focus areas that align with the food as medicine definition. They can pair that with target shoppers, as well as those recommended program models. But ultimately, what we wanted to develop was a framework that was grounded in research and proven outcomes that we got from out of the scoping review. So I'm going to circle back to the literature review outlining barriers and facilitators to whole grain consumption that we talked about earlier. We're going to bring everything together now into a simple, practical applications that dietitians can implement with their clients, patients, customers, but really take this and use that food as medicine framework that we've talked about, that the Academy Foundation developed, and use that framework to really help guide the planning and the implementation and execution of these programs. So I'll put the slide back up here so we can take a review again at the key barriers to the facilitators of whole grain consumption that we discussed on the earlier slide. So take a look here at the taste, texture, poor availability, difficult to identify, and lack of knowledge as those barriers. And then again, the facilitators, opportunities that we can begin to utilize as we begin implementing programs to get individuals to take those methodical steps towards improving consumption. So using the food as medicine framework, you can begin to address barriers to whole grain consumption within those different focus areas, pairing key target shoppers with recommended program models. So we're going to start with programs that are aimed at promoting health and well-being of your patients or clients. So we're going to start with meal solutions that incorporate whole grains. So based on our scope and review research, I would recommend to combine an incentive program with personalized nutrition education, as well as path to purchase marketing. So this could include featuring a recipe with whole grain ingredients that are on sale with a food retailer's weekly ad. You could then pair this with cooking classes or store tours that are either offered in person, or in light of our current environment, these can be offered virtually as well. But then lastly, bundle the recipe ingredients with either a display or a signage in store through the retailer's e-commerce platform. The next example here, we're going to look at programs that are aimed at managing chronic disease. So this initiative involves a patient discharge program or an education that's provided to recently discharged individuals. For this example, you could consider developing a program that incorporates tailored meals or boxes of food that contain whole grain products, and then combine this with medical nutrition therapy provided by a registered dietitian. And then lastly, offering meal or food vouchers in conjunction with this program. This would also help to aim at reducing the cost burdens that could be associated with the perception of whole grain consumption, but also increase adherence to the program through this. I have one more example here. And this is, we'll talk about opportunities focused on improving food and nutrition security. So consider partnering with a community program to provide health screenings to individuals who are in rural communities, or to those who just may not have access to affordable healthcare services. And then based on the screening results, you could offer a food prescription specific towards whole grain foods, especially for any of the results that come back that these individuals really could benefit from increasing whole grain consumption in their diet. And then through the community partnerships, you could also have additional opportunities to provide coupons or vouchers that go along with food prescription to aid in the purchasing of those recommended foods. So I've just provided you with 3 very specific examples. But as you can see, the opportunities to utilize the food as medicine framework, it really is endless, especially through partnerships and community collaborations, and even better as funding opportunities to implement these programs become readily available. The Academy Foundation has developed several free resources and continuing education opportunities for registered dietitians. You can find all of these resources at the link that we have listed here on the page. It's just eatrightfoundation.org/food-as-medicine. But all of the research and the reports that I mentioned throughout the presentation is included here within this. And we also just last week launched a program evaluation guide as well that takes you through a step-by-step process for developing and evaluating effective food as medicine programs within your program or business. We also have continuing education listed, as well as a great 1-minute video that just really showcases the opportunity for food as medicine integrated into food retail settings. And lastly here, I've just included my contact information. Please do not hesitate to reach out to me if you would like to chat more about food as medicine or even the Academy Foundation's fellowship program. I'll take it back to you, Kelly.
Thank you both so much. This was really informative, and I know we packed a lot in here today. So I'm just going to go ahead and get started so that we can get through as many questions as we're able. I see they keep coming in. Allison, we did have a couple of questions about implementing this whole grain prescription program. So would you say there's a best practice for like where the client would go to collect their food? And also, does an MD or a DO have to co-sign on that, or how would that be implemented?
It really depends on the type of program you're implementing. There's current programs that are already in place that have great partnerships with retailers currently. A good program to really look at the example of how they're doing is the produce prescription program out of DC Greens and their partnership with Giant Food in the Washington, DC area. And so really the collaboration, what you really want to look at is what are those disease states or those areas that really could benefit that Kevin described, that health economics benefit. How can they truly benefit from increasing whole grain consumption in their diet? As registered dietitians, we are able to recommend or prescribe these whole grains that you can have through a partnership with a food retailer, in particular with Giant Food and how DC Greens does it. They get coupon vouchers that come with their prescription, and those can be redeemed at participating retailers. Safeway food stores in Washington State, as well as the Washington State Department of Health, has a very similar program that they do as well. And with these types of programs, it can either be redeemed with the dietitian on staff, through a pharmacy that they might have in store. Sometimes there's clinic, like health clinic areas that could be great spots, but sometimes it's just the whole store that's participating in it. And so just great opportunities to really collaborate with food retailers and increase access to these types of programs.
Thank you. And just a reminder for those of you who tuned in a few minutes later, we are going to be sharing these slides as well as the recording with you via email. And it sounds like, for any of you dietitians who are interested in building a whole grain prescription program, kind of inspired by what Allison described, sounds like some of the research that Kevin presented on, the economic benefits could be helpful in building a case to those stakeholders, so that we can get that upfront investment. So thank you for those questions. Kevin, we have a question about if there's been a measurable change in whole grain consumption due to the requirements for whole grains in the National School Lunch Program and the CACFP. Have we seen an increase in whole grain consumption since those rules have been introduced?
Actually, I haven't seen the data in regard to the National School Breakfast Program or CACFP to be able to confidently answer that one, but we do recognize that those programs do introduce more foods that include whole grain through the whole grain rich definition, therefore increasing the opportunities for the students to get those.
Great, thank you. For Allison, do you have advice for how to communicate with clients who might be drawn to like a keto style diet, or might be like nervous about eating grains or want to be grain free for whatever reason?
It's going to have to come down to that personalized and individualized approach. Having a background within food retail for so many years, working directly with the customers, the best route is to really get to know what are their barriers and start to find out what are their facilitators. Everybody is so unique. So once we're able to figure out what is that root cause that's really showcasing their just adherence or lack of adherence, or confusion around whole grains, we're then able to take steps towards moving them towards the direction of increasing consumption. But again, we don't want to go from 0 to 60. That's probably not going to be a great way to get them to where we want to go. So how do we make those methodical steps? I call them baby steps, but how do we get them nudging their lifestyle towards? And Kevin had some great examples on just, can you take it a quarter of a serving more, half a serving, a full serving size? How can we, again, begin to individualize and personalize that approach to helping them improve their health?
Thank you. Kevin, we had an interesting question asking about, a lot of the whole grain research being epidemiological. And this person had heard that, maybe there wasn't enough clinical research to be able to accurately state the benefits of whole grains. So can you respond to that and tell us what kind of research that we're working with and how we see the benefits of whole grains?
Yeah, it's a good point because when we're talking about epidemiological research, we're talking about population wide. So, thousands, if not even hundreds of thousands of people may be included in some of these surveys, and they are direction indicating. So as a result, you can't necessarily say that because one person or the results of the epidemiological data are going to be representative of every individual just because of the inter and intra individual variability. So it is meant to be applied to an entire population, not necessarily indicating that a person would always see a benefit that is represented by that research. So hopefully that kind of helps to explain that when you look at it a broad enough population, you would expect to see similar results, but you can't apply it necessarily to one person. It's not causal, I guess is the best way to describe that.
Thank you. Allison, we had a question about nursing homes in particular. This person is writing that they see a lot of the grain foods that are served within the food service component being more refined, and that there's an opportunity to include more whole grains. So how can the dietitian really empower that change and, shift from the food service angle?
Some of it's going to come from education and a bunch of different angles. So as dietitians, we always look at educating our patients or our clients towards the whole grain consumption. But sometimes it's working with the individuals who have influence over the food supply that's being provided, and how can we begin to include suggestions. So sometimes my biggest thing is it's always great to have a conversation, but it's always good to bring forth a potential solution. They can always take that step forward, but if there are what you're recognizing as the dietitian as opportunities to increase the types of grains that are being served, what are some of those simple, I would say take 1, 2, 3 simple solutions that really could, again, not make everything perfect, but take those steps towards that. And sometimes it's just simple suggestions that someone hadn't thought of yet.
Thank you. We have a question about like whole grains and affordability. So do you guys have tips for including more whole grains in the diet for consumers who are on a budget? We've done some price comparison data within the Oldways Whole Grains Council ourselves and have found that within certain food groups, there is a gap between the whole grain and the refined grain version. In some food groups, it was bigger than others. So I guess, do you have tips for navigating that?
Allison, do you want to go first? I've got some thoughts, but
perfect. Yes, I'll start. Definitely from what we have seen as well is mapping out the low-hanging fruit first. So are there different whole grains that are being featured on sale, or are they being featured in a retailer's weekly circular or weekly ad? How can you help build meal solutions from just those simple things? But again, you're looking at that affordability factor. So being able to create budget-friendly meal solutions, but then how do you make those meal solutions known to individuals? So that's where that path to purchase marketing comes. Are there displays that can be utilized in settings to really showcase affordable, budget-friendly, whole grain meal solutions? Are there signage or labels that can be made to really showcase and highlight the accessibility? The next thing is just applauding the places. So whether that's a retailer, if it's another source where you're getting these whole grains from, applauding them who actually prioritize and have available affordable whole grain options, and then shout to the rooftops on how these great places do provide those solutions. And so we just need to make it known more too, where we can find these great opportunities.
And I would just build in regard to being part of the food industry is that we've looked at the differences, discrepancies between those. So there's places that we would see that there's larger gaps between the costs. For example, bread is some place that we would see that refined grain breads are typically going to be significantly less expensive than whole grain bread because there's a lot of complexity involved with making bread with whole grain. It is more challenging to do. Where we see that there's less of a difference between foods, where there's a great deal of parity, is in regard to things like ready-to-eat cereal, snack bars like granola bars, where a food like ready-to-eat cereal made with whole grain is typically no more expensive than a food that's made from refined grain. And the same, I think, goes with the snack bars as well. So there are places where you can obviously, shop and look for opportunities to save money while still getting the whole grain benefits.
Thank you both. And we're getting some great suggestions in the comments section as well, people chiming in with their own ideas we're having someone saying like they mix half refined pasta and half whole grain pasta. I've seen moms call that like zebra pasta sometimes. We're having people remind about bulk bins and, other affordable places to look. So thank you all for contributing to this part of the conversation.
I would contribute one thing, Kelly, to that too. We're seeing with this concept of food as medicine too, we're seeing it expand so many different places. And I saw a comment in the questions on, is this approach being marketed to hospitals and doctors? And we're truly seeing this approach being implemented in that healthcare space. So you're seeing that co-location of food pantries and health clinics to really bring this concept to life on a scale type basis. You're seeing food bank partnerships happening. And so there's so many different opportunities to begin to implement these types of programs, and even that reimbursement and funding opportunity, if this is something you're interested in pursuing. On our website, our resource page, we have some great tips and resources on even that funding and reimbursement opportunities for you to pursue.
Thank you. I see we have a question coming in about, consumers sometimes get confused about like whole wheat, whole grain, multigrain. There's different terms. Allison, do you have a suggestion for like easy, memorable ways to help your clients navigate that aisle or things like that?
Best one, take a little handout. So most of the aisles that you see, they're going to vary a little bit, but for the most part, they're pretty consistent. And so do you have an aisle mapping type handout that you can create? Something super simple. Think of like wallet size, something that can fit into a purse. If you have contacts with a food retailer, or you happen to work for a food retailer, how can signage and labeling play a role? And even just different ways that the food industry is working towards educating and marketing the concept. How can we educate and market our customers, our patients and clients towards understanding what some of this labeling means, helping them just navigate through what I call there's just so many different things and concepts out there. So which ones are the most memorable, the easiest to educate on, but make it simple and make it easy and convenient for those individuals.
Thanks. And there's been so many new products today that weren't available maybe 5-10 years ago. So the options might have changed. We get the question about whole wheat and whole grain a lot at the Oldways Whole Grains Council, and we remind people that whole grains are a food group. And whole wheat is just one of the foods in that food group. And in the same way, like if your doctor told you to eat more vegetables, like that doesn't mean you're only supposed to eat carrots. And so if we're trying to get people to eat more whole grains, it's not that we're just looking at whole wheat or just looking at brown rice, but really trying to explore the whole category, and get the benefits that each of these grains have to offer. Let's see. We had, we had a question. I'm not sure if I'm following exactly what they're asking, but perhaps this will resonate with either of you regarding the food prescriptions. If there's a mapped model using WHO guidelines for whole grains. So I wonder if they're asking about like if there's a specific quantity or if this is more of a general recommendation.
And I have not seen specific recommendations that have come out, more of just what has come from the programs that are currently being implemented. Kevin, I don't know if you've seen anything within your research as well.
No, the same here. So I have not seen specific guidance come from WHO, because obviously that would be one of the entities that we would detail with these type of data, because WHO recommendations are often adopted by individual countries. So it would save us a lot of time having to influence on individual health ministries and such globally if we could just go to WHO. It is an audience that we would like to take this to so that they could help us in the development and the dissemination of these clear and consistent dietary guidance around whole grain. But to my knowledge right now, I have never seen anything come from them specifically promoting an amount or source of whole grain.
Yeah, there was someone from the WHO presenting earlier today on an International Whole Grain Day webinar. And they're talking about that they're looking at guidance for fiber, potentially increasing that. But he didn't make mention of a specific increase of a whole grain, although he certainly did speak to the importance of whole grains in the diet and the importance of, their role of fiber, because he talked about the two together. So hopefully we'll see movement in that in the future. And additionally, as Kevin spoke to about the different types of research, I do think they take a cautious approach. And so I think, they want to continue to see more studies, continue to come in both from the epidemiological side and also the clinical trials as well. So we're getting there, but perhaps not quite yet. Let's see. Allison, do you have tips for when working with clients who have a wheat allergy or gluten intolerance? Like, are there certain whole grains that resonate really well with people, or kind of baby steps for people who might need that?
Well, yeah, as Kevin mentioned, there are so many new products now that are out on the market. So as the healthcare practitioners and dietitians, become familiar with and just walk your grocery aisles, see what is out there on the shelves, take a look at the different offerings. One of the best ways that you can recommend different products is simple customer testimonials. So that was my favorite part, working directly in the aisles with customers, was just those testimonials. We were able to see this product, cooks up just perfectly and it tastes great. And then we were able to feature it when it was on sale. Or, there's other customers that are like, I tend to do this with this type of product. And so, but the best thing you can do as a dietitian and a healthcare practitioner is not just the overall guidance, go specific with the products, go walk that grocery store aisle, get to know what those different grains are, get to know, but really, what are these products where these grains make up? And then that way you can be as specific as possible and the most help for your patients and your clients.
Thanks. And it looks like we're about out of time here. So thank you all for your attention today. And we will send you this recording. We'll send you the slides. So check your emails within 1 week. You'll be getting it. And I think that's about all I have. So thank you so much to Kevin and Allison and the Bell Institute for Health and Nutrition. And we will see you again soon. Goodbye, everyone.